Welcome to Baseline Medical. Our mission is to help as many people as possible identify their risk for vascular disease and then provide options for reducing their risk, since stroke is the number 3 killer of men and women and the number 1 disabler of people. According to the National Stroke Association, up to 80% of strokes can be prevented. I want you to think about what I just said because it's too important to pass by. According to the National Stroke Association, up to 80% of strokes can be prevented. There are approximately 7 million victims with cerebral vascular disease or stroke. Most do not die from their initial stroke. Instead, they live the rest of their lives disabled, which impacts them and their loved ones. Just think of the human cost in lost occupations and the family pressure in caring for a loved one who has suffered a stroke. The medical, social, and economic costs are staggering. Yet 80% of this impact could be prevented if you just knew how to apply 2 simple but life-saving techniques. The first technique is what Baseline Medical specializes in. That is the assessment of your risk through a non-invasive technique. While there are many types of non-invasive techniques, the most effective is an ultrasound screening of the carotid arteries to identify the presence of vascular disease such as plaque formations, which can increase your risk for a stroke. This is an inexpensive method that, when combined with a complete medical history, along with your associated risk factors, can help you and your physician identify health care decisions that could range from lifestyle changes to supplementation to medications to surgical procedures. The second technique is learning how to properly nourish your endothelium for improved nitric oxide production, which Baseline Medical can also help you learn how to do. Now, I've most likely introduced you to an organ that you have never heard of, and if you have, most likely do not understand its importance in cardiovascular health and the prevention of strokes. Your endothelium is the largest secreting organ in your entire body, yet it's only 1 cell thick. It lines the inside of your heart. The inside of all your arteries and arterioles, veins and venules are lined by this organ. Your capillaries are just extensions of the endothelium. Research over the last 10 years has clearly shown the endothelium to be a multifunctional organ involved in metabolic, immunologic, and cardiovascular health. One of those functions is to convert the amino acid L-arginine into nitric oxide. Nitric oxide is so important to your cardiovascular health that the 1998 Nobel Prize in Medicine was awarded to 3 American researchers who discovered how your endothelium converts the amino acid L-arginine into nitric oxide, the master signaling molecule of your entire cardiovascular system. One of these Nobel laureates is Dr. Louis J. Ignarro, who wrote a national bestseller called No More Heart Disease. I'd like to focus on the subtitle of his book. It says, How Nitric Oxide Can Prevent, Even Reverse Heart Disease and Strokes. To emphasize this point, I'd like to read a short quote from Dr. Ignarro's book. 2 of nitric oxide's critical functions, preventing the formation of blood clots and keeping the arteries free of plaque, work specifically against the occurrence of stroke. End of quote. We'll look at this in greater detail in just a little bit, but first I want to introduce you to Dr. John Cook, the Director of Vascular Medicine at Stanford University, who published a book called The Cardiovascular Cure. Notice his subtitle, How to Strengthen Your Self-Defense Against Heart Attack and Stroke. Dr. Cook goes on to say the following, This book will introduce you to the magic that is inside your blood vessels. It comes in the shape of a molecule, one of the simplest molecules found in nature. This molecule is nitric oxide, or NO, a substance so powerful that it can actually protect you from heart attack and stroke. Best of all, your body can make it on its own. Nitric oxide is your body's own built-in natural protection against heart disease. End of quote. Baseline Medical has joined a growing body in the medical community who are focused on the health of your endothelium and the need to properly produce therapeutic levels of nitric oxide, since both are critical to cardiovascular health and can substantially reduce your risk for a stroke. In fact, let's narrow this whole issue of stroke even further. The number 1 risk factor for a stroke is high blood pressure. It's estimated that if you have high blood pressure, you increase your stroke risk by a factor of 4 to 6 times. Additionally, the number 1 cause of a stroke is a blood clot formation that lodges in a vascular artery. According to the American Heart Association, 87% of all strokes are ischemic strokes. An ischemic stroke occurs when a blood clot forms in the bloodstream. This blood clot then lodges within an artery of the brain, causing a blockage. This blockage reduces the necessary blood flow to that section of the brain, leading to damage or death to those brain cells. The amount of damage determines the severity of the stroke. Both of these issues, high blood pressure and the formation of a blood clot, result predominantly from endothelial cell dysfunction and its inability to properly produce nitric oxide. This information helps us to clearly identify three keys to substantially reducing the risk for a stroke. They are controlling blood pressure, preventing blood clots, reversing endothelial cell dysfunction. So here's how nitric oxide directly addresses each of these keys. First, nitric oxide is your body's most powerful vasodilator. What this means is that nitric oxide causes the smooth muscle of your vascular wall to relax, which helps to keep your blood pressure in a normal range. That would directly benefit our first key of controlling blood pressure and directly address the most important controllable risk factor for a stroke. Second, nitric oxide keeps blood platelet cells from sticking together to naturally prevent blood clots. This would reduce the number one cause of strokes and directly address our second key, which is preventing blood clots. Third, nitric oxide helps to repair damage done to the endothelium and keep it free from plaque formations and calcification. According to the American Heart Association, 74% of all cardiovascular disease is related to atherosclerosis, plaque formations within the arteries, and arterial sclerosis, calcification or hardening of the arteries. Proper levels of nitric oxide help to prevent both of these issues, and it directly addresses the last key of helping to reverse endothelial cell dysfunction. So how does your endothelium create this nitric oxide? Well, there are two important amino acids needed. They are L-arginine and L-citrulline. Your endothelium directly converts L-arginine into nitric oxide, but it needs a certain level. Most research indicates that for you to receive a therapeutic benefit from L-arginine, you need to consume at least 5 grams of this amino acid at one time. Additionally, your body needs the amino acid L-citrulline. L-citrulline recycles L-arginine to help extend the production of nitric oxide over a longer period of time. We found the easiest way to achieve this combination is through supplementation. But if you choose to supplement, then purity, potency, and the clinical application of the ingredients used are highly important. We believe ProArginine Plus from Synergy Worldwide meets these three factors. In fact, many believe it's the best nitric oxide supplement in the marketplace. It has been intentionally designed to help nourish your endothelium to properly produce nitric oxide for improved cardiovascular health and function. ProArginine Plus contains both L-arginine and L-citrulline at the needed levels to help turbocharge your endothelium's ability to produce nitric oxide. Additionally, ProArginine Plus also includes the following ingredients: vitamins B9, B6, and B12, vitamin D3, vitamin K2, vitamin C, D-ribose, grape skin extract, red wine extract, pomegranate extract. The reason why ProArginine Plus is so effective is because of the science and manufacturing expertise that has been used to create this product. It's manufactured by Nature's Sunshine Products and distributed by Synergy Worldwide. Both have received the NSF Good Manufacturing Certification, which means that they meet the highest standards in the nutrition industry for quality assurance and control. The manufacturing process to create the proprietary formulation of ProArginine Plus is second to none. A total of 262 tests are conducted along the various stages of manufacturing to ensure the highest quality and potency of the ingredients used. This level of quality is also reflected in the people who are associated with this product. On the screen is Dr. J. Joseph Prendergast, considered by many to be one of the leading authorities in the world on the use of L-arginine for the treatment of cardiovascular concerns. Dr. Joe contributed his 20-plus years of practical experience and research with the nutritional scientists at Nature's Sunshine to develop the ProArginine Plus formulation. What also makes this product unique in the nutrition industry is that it has clinical application and studies to back up its effectiveness. The High Desert Heart Institute is located in Victorville, California. In 2009, they did a human clinical study using arginine plus. This study involved 33 congestive heart failure patients who were all medically and pharmaceutically managed to the maximum. Over a 90-day period, these patients were given an aggressive amount of arginine plus, and by the end of 90 days, all patients had their medications substantially reduced. Because of these remarkable changes, the High Desert Heart Institute uses arginine plus as part of their standard treatment program for their patients. So what does all this information mean to you? Well, a healthy endothelium equals a healthy cardiovascular system. And when you look at the number one risk factor for a stroke, which is high blood pressure, and the number one cause of a stroke, which is a blood clot that has lodged itself in a vascular artery that usually has some level of plaque formation, nitric oxide can directly address each of these issues. Nitric oxide relaxes the vascular wall to help keep your blood pressure in a normal range. Nitric oxide keeps blood platelet cells from sticking together to naturally prevent blood clots. And nitric oxide can repair damage done to the endothelium to help reverse endothelial cell dysfunction. We believe a simple, non-invasive screening can help you identify the presence of vascular disease. And we believe that a preventative approach, by learning how to properly nourish your endothelium for improved nitric oxide production, can go a long way towards reducing your risk for a stroke. This leaves us with a final question. Are you ready to call Baseline Medical to help you assess your risk and help you determine a plan of action? If your answer is yes, then please contact us or one of our affiliates. We can assist you in setting up an appointment for an ultrasound scan of your carotid artery with the results obtained in 10 minutes. And while your results are being processed, we can also discuss how arginine plus can benefit your cardiovascular system and help you purchase this product. To help you make the call, I placed our contact information on the screen. We're part of a team whose mission is to help save 1 million lives. We'll work with you and your healthcare provider to properly assess your risk and help you learn how to nourish your endothelium for improved nitric oxide production. Please call us if you have any questions about our services and this remarkable product.